I'm really excited to be here today with Melissa Lever, Head of Reward and HR Systems at the Magic Circle law firm Linklaters, Claire Yule, who is President of Reward and Mobility at the global engineering and consultancy company Wood PLC, and Dr. Nick Taylor, who is CEO and co-founder of Unmind, the workplace mental health platform. And I'm really looking forward to hearing from the three of them how employers and mental well-being experts are rethinking resilience. So I'd like to turn to Nick first. Nick, we've seen a huge shift in the way employers view burnout and stress, with leaders around the world rallying around resilience in response. What do you think has caused employers to finally act so very differently?
I think it's so important to, whilst all our focus is on the pandemic around COVID, and rightfully and understandably so, it's so important to remember the scale of the problem that we were facing pre-COVID when it came to mental illness in the workplace. You know, the figures have been staggering for a long time, from 1 in 5 to 1 in 4 to 1 in 3, whichever stats you're looking at around the world. The point being, there's a huge proportion of our working organization which is struggling, our employees that are finding it difficult day to day. So we knew there was a problem before. What COVID has done, in addition to being a physical health pandemic, is created a pretty difficult position for the mental health of employees. Every part of our life has been changed, threatened, or made more difficult as a result of COVID. So mental illness is getting more of a problem than it was even before, and it was a big problem then. So we cannot avoid this as a topic. We absolutely now need to focus on it, and organizations know that. But there's also a more positive part, which is that as a result of the topic being front and center of our minds and people really thinking about it, that's actually helped to destigmatize the topic of mental health. And now organizations are not only seeing it as a problem, but seeing it as an opportunity to help their employees really thrive and have optimum mental health. And of course, we all intuitively know, and the science backs it up, that when we are performing at our best, we do our best work and we bring our best selves to work. So there's a great incentive for organizations to really authentically care about this topic, because ultimately it will have a very positive impact on reputation, culture, and performance.
So, Melissa, before the pandemic, what did resilience mean to Linklaters? And would you define Linklaters' resilience strategy differently now?
Yeah, I mean, I think historically, and I'm not sure whether this is a Linklater specific thing, but historically, I think resilience was viewed as almost something that could be fixed. So people were working long hours. What do we do to make them more resilient? People were going to bed with their mobile phones. What do we do to make them more resilient? People couldn't take constructive feedback. What do we do? And I think even before the pandemic, mindsets were shifting so that it was really much more nuanced than that. And that was being backed up in our mental well-being strategies internally. But I think with the collective experience that we've all gone through in lockdown, I really do think there's an appreciation now that everybody can experience resilience in different ways, and what might be fine for one person might not be fine for somebody else, and that everybody's in their own different circumstances. And it does feel to me now that there's a recognition that it's something to be aware of and supported, and that it can, that everybody feels this at some point and feels a lack of resilience or feels more resilient at different times of their lives, no matter what their circumstances, rather than a point solution which you need to go in and fix. So I think that's how, for us, it really feels like it has moved, the debate's moved on.
So Claire, what did resilience mean to your organisation, to you as a reward director, historically, and what do you think resilience means today?
I think historically, like many organisations, we've probably been more reactionary. So we've come across a problem or an opportunity, then we've identified a solution, whether we can do that internally or have to go externally, and that's for our customers, our vendors, our people, and our communities. And then we implement it. And I think Wood, as well as my reward team, we've been incredibly successful during our history of adapting, of seeing these new opportunities and adjusting our business model and our priorities around that. So, we've definitely demonstrated resilience historically, and we've bounced back from previous difficult times. But today, I think the difference is we're much more focused on proactivity and being prepared. So our approach to resilience is actually in line with our safety shield. That pulls together our health and safety processes and procedures, which is really about driving a simple, consistent message for our people aligned to our values. So our 3 elements of our shield that we use are about being prepared. So it's about taking commitment to prepare. It's engage. That's about taking care to engage with others. And then intervene, because it takes courage to intervene in situations. So really for us, resilience is about understanding why the way we feel the way we do. It's about us identifying and developing strategies to help us deal with situations more effectively, whether that be on a personal level or on an organisational level. It's been about us opening up the conversations within our global community, about us understanding and strengthening our resilience across Team Wood in order to keep our people and our operations and our communities safe. So it's not really just about bouncing back now, it's about bouncing higher.
Nick, would you say that the definition of resilience has been changing over the past year and into 2021?
I think it's a really interesting question, and I think useful to just pause and reflect on what do we even mean by resilience. And I sometimes wonder whether we give enough time to actually think about what we're describing here. There's an amazing definition by Panterbrick and Leckman that they gave in 2013, and they described resilience as a process to harness resources to sustain well-being. And I think that's a really important way of thinking about this topic. It's not simply avoiding burnout and avoiding stress. It's much more than that. It's about how do we sustain well-being. And it's really important that that broader holistic definition is considered when we think about how we apply a focus on the topic. And ultimately, when we think about a human being's health, it's made up of biological, physical parts of our lives. So in other words, how healthy our body is, our age, our gender, whether we have any diseases, our nutrition, our sleep, our exercise, fitness, etc. It's made up of social parts of our life, which are our work environment, our home environment, our relationships, our finances, etc. And then finally, it's made up of our psychological life. So our core set of beliefs about the world, our personality types, how we think about things. And those 3 areas of our lives, the biological, psychological, and social, make up that whole person. And it's really important when we're thinking about giving people the resources to sustain well-being, that we're thinking broadly across those different areas of well-being.
Claire, how did resilience change at Wood, specifically in the last year during the pandemic? Either what you had to deal with or how you did it?
I think it's become much broader for us during the past 12 months, and it's really been about us trying to create cultural change to make sure that we're not only resilient and fitter as an organisation, but also as individuals and focused on the future. It's about how we get ourselves ready to come out of this and take advantage with that. So it's been about us developing tools to help our people, to help them support themselves, to develop resilience for all aspects of their well-being. With regards to well-being, rather than maybe just the traditional areas which tend to be focused around occupational health and maybe a little bit of emotional health within there, we've actually changed our strategy around that, and HR partnered with health and safety. So we've developed our wellbeing strategy, which has 6 pillars. So emotional, physical, financial, career, environmental, and social, and then the tools to go around that. And really it's about, with resilience, is about having the ability to be able to cope under pressure and recover from these setbacks, not only for us personally, but also for our teams and the broader organisation. And I think we've all experienced that in the last 12 months. Who'd have thought we'd be where we are? So developing and strengthening resilience will not only protect us from the challenges, not only from a work perspective, but also our personal well-being as well. And if we've got that piece supported, then we find people do better in the work environment as well.
It really is something which is, it's, you know, people are becoming really human about this. You know, everybody's gone through an experience together which has tested their resilience. I think there is a recognition that you know, quite subtle things make a real difference. So, you know, even small things like, you know, seeing your partners in their home environment on a Zoom call, in their weekend clothes, or with their dog jumping across the screen, it makes people appreciate that we're all going to do this together. And certainly our senior partner has made lockdown videos, which has been sent out globally to our team. And at one point in particular, he did talk, I think it was at one of the, when we were going back into a lockdown, about how that had made him feel really low. And, you know, he talked about his own personal experience and what he did about that. You know, and it was just a day-to-day life, you know, 1 minute he was and the next minute he wasn't. So it was that sort of thing I think has been really powerful and made people feel a lot more accessible, a lot more understanding that it is the small things sometimes which actually make all the difference. Saying thank you, giving some positive feedback, just ringing up somebody to check in on them and say hi, rather than to talk about a piece of work that has made people pull together. So yeah, it's those sort of little things I think that have really developed, and long may it last.
And would you say that this view of resilience has actually become broader then across different areas of well-being, rather than being quite sort of a deeper dive, narrow focus?
Yeah, I think there's an understanding that, you know, resilience can be, you know, your approach to things and your resilience and how you're feeling can impact all sorts of different areas of your day job, and also your performance, your potential. So I think, as I said it before, instead of it being something which might happen to you at a point in your career and you need to fix it and move on, it's something which needs to be looked at through the lens of the culture of the organisation, how our leaders treat their teams, how people who are potential future leaders in the, you know, leaders of the future are assessed for their potential to move forwards. So yeah, I really do think it has become a lot broader at Linklaters.
We've talked for years about work-life balance and what that means, and we've heard things like bring your whole self to work. And now I think we've been through a pandemic. Many of us have realized that we might have thought we were bringing our whole selves to work, but now we've got used to bringing our whole selves to work by children in the background of Zoom, puppies peeing on the floor, delivery people coming to the door during meetings. You know, we truly are now bringing our whole selves to work. It's very difficult at times to differentiate our working life and our home life. And I think that there's potentially some real benefits from having been through this hard period, and potentially some opportunities for having a lasting impact on creating a working environment that does allow people more flexibility, that does allow people to be more authentic and bring themselves to work, and respects the diversity within a population of employees. Of course, the diversity is enormous. We are all so different. And actually, maybe we can hold on to that part of what we've been through over the last year, and that can make tomorrow's world a bit better for everyone.
What would you believe are the immediate steps that employers can take to build a true organisation and employee resilience?
I think there's so many things, and it will ultimately be a little bit different for every type of organisation. There are some really good, important core pillars that we need, I think. One is that leaders need to speak about the topic. They need to speak about well-being. They need to be committed and invested in it, both financially, emotionally, and by time. But we also need a bottom-up approach as well, and employees need to kind of speak with what they want. You know, we want an environment where I can bring my whole self to work. I can be supported in my well-being, etc. So that bottom-up and top-down approach. I also think it's incredibly important that the strategy is well considered for the culture of the organization. No two businesses are exactly the same, and therefore it's unlikely that any two strategies around well-being will look exactly the same. And as part of that, yes, it's about different types of offerings you could give, but it's also about the language that you're going to use that will resonate with your people, and whether that language can be aligned to the values or the culture of the business in a way that will help it resonate and break through. And we don't need to necessarily use the word resilience. We don't need to use any particular words. We can use words that work well in our organizations. And then once that strategy is in place, making sure that it is a long-term strategy. Wellness doesn't happen overnight. It takes time to cultivate wellness, and that it requires a long-term investment. And then crucially, we must move beyond the old-fashioned focus on reactive healthcare as the thing that we put all our effort in, and move towards proactive healthcare. Prevention is better than cure. Everybody knows it. And that's where we put our energy. We can not only help people stay well and thrive, but we can prevent the problems from occurring in the first place. So important to get that balance right.
Claire, how is the emphasis on resilience influencing your wellbeing approach and strategy now?
I think our approach and strategy is now really focused on about inclusivity. It's about involving our global teams rather than a traditional top-down approach. So within our wellbeing, we have a global wellbeing community of practice with leads identified for each of the wellbeing pillars. But we've now inducted more than 150 wellbeing champions who are based in most of our 60 plus countries. So we've got that real richness of experience coming through, ideas coming through, challenges coming through, and just getting a much more engaging conversation. We're really encouraging our people to get involved and to get connected and share their stories. And I think that's one of the significant changes that we've seen in the past 12 months. We have people sharing what their story has been, what they've done to overcome, mental well-being challenges. We would never have talked about that 12 to 14 months ago in the way that we're talking about it now. And people have the courage to come forward and share their stories because they know it's helping others in that wider Wood community. So we're really pleased with that, and we're really proud that our people have taken that approach. So that inclusive aspect has probably been the most influential aspect to our wellbeing approach, I would say.
Melissa, you mentioned that the view of resilience at Linklaters is evolving. How is this going to influence your wellbeing approach during 2021?
Yeah, I think that's a really interesting one because I think there's a real wait and see about how the culture of the organisation will be impacted when people start returning to the office. So, we all suddenly had to work from home, and everybody adapted brilliantly and quickly. And that has really impacted, I think, the culture of the organisation for the last year. And I don't expect that it will just revert back to how it was before, but there will be some changes in the other direction. And, we will be working in an environment where the importance of collaboration and human contact is really important. The working lives of people and the fact that we will be working from home and the trust that comes with that and the changes in how we have viewed each other as individuals will still be there as well. And I think we need to sort of understand how that looks together before we sort of decide on our future strategy. So I think it will influence it, but I'm not quite sure how yet.
What trends or themes do you think employers might be considering, especially as we go into a stage where people might be going back into the workplace and they've been working at home for a long time, or people have been going into work, they might have more colleagues joining them, and that impacting in some way on their feeling of resilience, the safety we've built up around ourselves under the pandemic. What do you expect to see? How can employers manage that in the months ahead?
It's so important to remember that human beings, as all animals, we find change difficult. And we've been so brilliant at adapting to the COVID world. But it's not going to be as straightforward as just clicking back into the new life. It will take time. We must be supportive to people, and every person will have a different relationship with that transition. Some might find it really easily, might be desperate to get back. Others will find it really difficult and will actually have got used to some parts of their life now which they prefer. So it's important to be supportive, to allow that process to take time, and ultimately let's keep the focus on well-being. We've done so much great work in the workplace globally. Thought leaders are really driving this topic forward. Let's keep that focus, because we've got a huge job to do. The pressure on employees as a result of lockdown, as a result of the pandemic, is unprecedented. And it's not just going to evaporate, that pressure, once we return to a post-COVID world. There will be a lasting impact. And as organizations, we have responsibility to be invested in the long term in our people's well-being. Let's focus on prevention. Let's embed data at the heart of that so we can demonstrate the value and effectiveness. Because if you can't measure something, you can't manage it.